And we are a little late, and I would like to introduce Christina Wanga. She is from
I didn't give Hiv Aid.
Peel HIV AIDS Network, and she is the Women's Community Development Coordinator. Basically, she is back from Kenya. I worked in Kenya, and she was very happy. I was telling her that I could work in different clusters of their country population when we were doing cattle surgery there. So Kenya is a very beautiful country, and it is really green country, and climate is almost like today we have here. So she's from Kenya basically, but nowadays since more than a decade she is assembled here. She is working as a health care worker in this organization. So today she is talking about HIV and AIDS, how to control, how to prevent. So let us listen to her. And another announcement is that if Mr. Nasir Tetta allows me, that on the 5th June, there's one lady coming from Cancer Society, and she will speak about prevention and control of cancer. So please welcome Tina with the begins.
Thank you very much for having me here today. Am I loud enough? Can everyone hear me?
Yeah, please speak. We will listen to you.
Okay. If I go low, please just let me know. Sometimes I forget and speak lower. Okay, so as we mentioned, my name is Tina, and I'm Women's Community Development Coordinator at Hiv AIDS Network. And I work for an initiative known as the Women HIV AIDS Initiative, and this initiative works in Ontario, looking at HIV prevention among women. So my presentation has a lot of things around women, but I will present it because it's a mixed group. I will present it from a bit more general perspective. But if you see my slides, there's a lot about women. But just so you know, it's because I work for the women's program.
Tina, I have a question. If you kindly put the question session at the end. In between your lecture, the question, it will look nice and it will break something.
Okay.
Yeah, so this is announcement from your side that the questions and such will be in the end. Yeah, great.
Okay.
Please continue.
But then I will have questions for you, which I will be asking as we go, because I'd like this to be a discussion presentation and not just me speaking the whole time. So if that's okay with everyone, I will be asking questions for you. Okay.
It's a chance to interview.
Exactly. So part of the initiative I mentioned I work for, so we work around reducing HIV transmission for women, and then working with organizations to address HIV/AIDS prevention, and also building safe environments to support women living with HIV. And then the reason this initiative is around is because it's been determined through research that women's vulnerability to HIV is because of the determinants of health and also people's individual lived experiences. So can anyone tell me what determinants of health are?
What's the question?
What are determinants of health? The social determinants of health?
Determinants?
Yeah. So what that means is what are the things that affect someone's health?
Diseases, all different kind of disease,
Yeah?
like diabetes, AIDS, of course, heart problem, strokes, and kidney, everything.
Okay. So when we talk about determinants of health, when we talk about HIV prevention, is looking at things like if you have a job, if you have a house, if you have food, are you able to see a doctor, if you have health insurance or if you don't have health insurance. So looking at different things that affect your health beyond just the disease itself. Okay. So I'm just going to skip some of this. This is just some statistics for HIV among women. So this one, I'll talk a bit about this one. So in Ontario, for women, HIV numbers are high, and women get it through heterosexual sex. So that's how most women get HIV in Ontario. Then we also have through substance use, so whether that's using drugs through injections, or specific communities have higher rates of HIV than other communities. Okay.
What are the perfect three things?
Sorry?
You have shown three things.
Or in my graph? Okay, so the yellow one is heterosexual, and then the middle one is African Caribbean Black communities, and then the purple one is injection drug users. So these are three main groups that women living with HIV in Ontario. And this goes the same for transmission in Ontario. And then this is around HIV new infections in Ontario. So the statistics we have is from 2009. So in Canada, HIV statistics are quite a few years behind. So we're looking at 2009 and we're in 2014. So we don't have very recent statistics. And again, it shows you African Caribbean Black communities have higher rates of HIV among women. But that doesn't mean other communities don't have. It just means this community is affected more than other communities. And then again, through heterosexual contact, and then also through injection drug use. Any questions? Okay. So as I mentioned before about social determinants of health, so we look at things like poverty, education, gender inequality, access to health services, security, housing. So all these are things that affect people's health and well-being, and it's not only for HIV prevention, but also other healthcare issues. So even when you look at something like diabetes, it could be someone doesn't have somewhere to exercise, or they don't have enough money to buy the right kinds of food and things like that. So for HIV, we also look at it from a bigger perspective of how someone's health is affected. So I'm gonna skip that. And HIV and stigma, and I'll come back to this slide as well. So question for everyone, what is HIV? What is HIV?
It's a virus.
It's a virus. And what does the whole HIV stand for?
Acquired.
Yeah?
Humanly acquired virus.
Yeah, so it's the human immunodeficiency virus. So HIV is a virus. And okay, HIV is a virus. And what HIV does, it targets the immune system. So in our immune system, the cells that keep us healthy are the white blood cells. And the HIV virus loves the white blood cells. So the cells they love is the CD4 cell. So it's a type of white blood cell. And then what it does, it attaches itself to the cell and it makes copies of itself. So someone can have a certain amount of the virus, and over time it can increase. And what is AIDS?
Actual disease, the full blown.
Okay.
AIDS is immunity deficiency. I don't remember what AIDS stands for.
You had some of the words in there.
Yeah. Acquired immunity
deficiency syndrome.
Exactly. So that is AIDS. So what is the difference between HIV and AIDS?
HIV is a virus, so you can have the virus for many, many years and still not have the AIDS yet.
Oh, okay.
It takes a while before the full-blown AIDS hits the body, isn't it?
Yes.
What the AID stands for?
Acquired immunodeficiency syndrome.
Syndrome.
AIDS is the S stands for syndrome, so the virus is not activated in HIV. And as soon as the characteristics become present, it becomes a syndrome, and it becomes AIDS. And AIDS is terminal usually, or HIV isn't. I told you.
Okay. So acquired, basically, as it stands, it's something you get. So you can't get AIDS if you don't have the HIV virus in the first place. So, and it's a syndrome, which means it usually could be more than one illness. So when you talk about AIDS, it's not just one illness. It doesn't mean that if someone has, I've used pneumonia as an example because pneumonia is a common illness that people living with HIV can get. It doesn't mean that if someone has pneumonia, they have HIV necessarily. So someone can have HIV and can move to AIDS, but can also move back to HIV. So in different parts of the world, they define AIDS as having 2 or more syndromes. So it could be, again, I've used pneumonia, and maybe I can use something like tuberculosis as an example. So you have 2 or more, then you're defined as having AIDS, but then, and also your white blood cells has to be a certain amount, and usually it's 250. Some parts of the world say 300. In Canada, it's usually between 200 and 250. If you have that low, then you're considered to be having AIDS. But if someone's on medication and they don't have any other illnesses, they're living with HIV. So when we talk about HIV/AIDS, we do talk about someone living with HIV. We don't say someone living with AIDS. Not anymore. And usually because if someone's on medication, you do not even know that someone living with is living with HIV. Yeah. So the AIDS is acquired immunodeficiency syndrome. So as I said, you have to be HIV positive. And the illnesses I'm talking about are referred to as opportunistic infections. And again, these are illnesses that anyone can get. Even there's a type of cancer, skin cancer, that people living with HIV are at risk for. But because they have that cancer doesn't necessarily mean they're living with HIV. And it can be treated. So in 2014, there's medication, people are living long, healthy lives, even if they're living with HIV. So unlike the early days of HIV, people are living healthy, long lives. And HIV is not a death sentence as it used to be in the early 80s. Questions? Okay.
Should you ask question now or at the end?
Oh, you did say at the end. Write them down so you don't forget. Okay. So, as I mentioned, there's different treatments available in Ontario, and they're very expensive. So can someone give me an example of how much they think HIV medication can cost for someone in, let's say, a month? To buy, to access?
Somewhere between $3,000 to $4,000.
It can be possible. Anyone else? Yeah? So I'd say between 1,000 even up to 5,000. So depending on the medication and different things. So I don't think it gets to 10,000, but I think with the newer medications coming in, there's some which are pretty expensive. But even at $1,000 to $1,000 a month is quite expensive already as it is. So if
Okay.
for someone living with HIV and let's say you're working somewhere, some people your health insurance at work will pay for it, will cover it. Some places will not cover it. And if you're accessing, let's say, Ontario Works or the Ontario Disability Support Program, then medication is covered that way. So medication is there, but it's still very expensive for a lot of people. But for people who have access to the medication, then, as I said, people live very long lives, and people may die not from HIV, but but from either other illnesses, even such as cancer. And today, HIV is actually considered to be a chronic disease. And then for women, different factors around HIV is women are more at risk because of gender inequality and inequity, physiological differences, and then violence against women and HIV stigma. So what is HIV stigma? Anyone? Yeah.
It's when somebody is HIV positive and people know around that person and they kind of isolate the person just because, or maybe say bad things, or I can't eat in the same plate, or I can't drink in the same cup, and all this kind of stuff.
And that's exactly what it is. So in my work, we work with people living with HIV, and also we have cases where people have lost jobs, people have been kicked out of their families, people are not talked to, people have been kicked out of communities because people have found out that they're living with HIV. So HIV stigma is real, and it exists, and it affects people. So the way I look at it, cancer, when someone has cancer, people are more sympathetic. But when someone has HIV, it becomes, oh, you did this to yourself, it's your fault and everything. But when you look at HIV can be transmitted in very many different ways, and you wouldn't know how someone got it, and at the end of the day, it doesn't really matter. It just means the reason people focus so much on it because HIV is a stigmatized illness. So when we talk about HIV transmission, how is HIV transmitted?
Blood confusion.
Huh?
It could be many ways. A lot of people have a misconception that it's only a sexual oriented disease, which is not true. There are many other issues in this. Lack of blood cells, certain types, and that could be because of your immune system failing and not responding to certain ways, and they can be exposed to HIV.
So I had one thing, HIV sexually transmitted. So that's just one way HIV can be transmitted. How else can HIV be transmitted?
Blood transfusion.
Blood transfusion. Yeah.
Breastfeeding?
Breastfeeding.
Saliva?
Can HIV be transmitted through saliva?
No.
No, HIV cannot be transmitted through saliva. So
Sometimes, like for example, if doctor just mentioned it, I'm going to a parlor having shaved, their instruments could be affected, and that can transfer.
Not sterilized.
Like during medical operations, if they are not properly cleaned, they can transmit it to.
yeah.
Other than that, those things that we know, but my question to you would be that other than that physical way, is there any other medical way that it can be transmitted, or it can just happen?
Okay. So with that question, I'll move on to the next piece. That looks at, so it's still about how HIV is transmitted. So there has to be a way for the HIV virus to get into the body. So as in what we're talking about through blood, so blood is a key route of transmission for HIV. Saliva is not. So when you look at something like, let's say, kissing, if someone has, let's say, blood in their mouth, and the other person has a cut in their mouth as well, and they have blood, then there's a possibility. But it is very, very low from that way. Because what we say, like HIV can be transmitted, but it's also a very, very difficult virus to be transmitted. Because what happens, it dies as soon as it's exposed. It dies. And in the case of talking about the shavers, what would be more of a worry will be things like hepatitis C. Less HIV as a concern. Because HIV dies very fast. And the conditions have to be perfect. So there has to be a source of infection, and then there has to be a means of transmission. So let's say if it was, I have a cut on my hand, and bleeding profusely, and someone came to help me, and they touched the blood, doesn't necessarily mean they'll get HIV. If there's no way for my blood or the virus to get into their body. Yeah.
Gina,
Yes.
sorry to cut you. I have a comment here regarding the transmission of HIV or AIDS.
Yeah.
So one reason is given the breastfeeding.
Mm-hmm.
So I will comment upon, since when the life came into being, the mammals, so this is the way to bring up our children or our babies in animals, in humankind. This is the most natural way. So this is not the direct cause of transmission of this disease. This can be indirect, but minimum percentage. The instructions have been given in the scriptures for the babies to feed a baby at least 2 years. Feed your baby in humankind at least 2 years, and it is different in the mammals. So this does not cause if the baby is allowed to be fed 2 years from the mom, and the husband and wife do the least relationship to get the women pregnant in that period, and there is proper diet for the lady, proper food, and she is not doing the whole job of the house and exerted and loses her immunity. So in these cases, if in the absence of these things, this can be a cause, indirect cause of breastfeeding, indirect cause, not direct cause, never can be. Because this is the most basic foundation of the life. So this is our research, humankind research. This is one cause of transmission of this disease, but this is least indirect cause. We research for 20 years. We recommend the Oscar milk and the Glaxo milk to our babies, and then we research back, and then we say the breastfeeding is the best and the most appropriate feed. In 50s we researched this, that breastfeeding causes there is some germs and infection and this and that. What happens to the cows and goats and the other, their babies, they do not have any infection. That is the natural, something natural. When someone catches some germs, life has to end. In animal life, in human being, life has to end by some cause, by some reason. So this is, if you kindly put in your, add in your lectures, that this is not a direct cause, because you will deny the nature. If you say this, that the breast is cause of transmission of this most dangerous disease, then you will deny the nature. You will deny the life.
Okay.
Sorry
so
about your patience.
That's okay. I'll give an explanation. So very important to understand, and I'm glad you brought that topic. So we do recognize the importance of breastfeeding, and breastfeeding has benefits to the baby. Definitely. That is not something I'll argue. So in Canada, a woman living with HIV, they can be charged legally if they breastfeed their child. Legally. It is the law, a woman can be charged if they know they're living with HIV and they breastfeed their baby. In different parts of the world, let's say somewhere where there's no access to clean water to get formula, they recommend it may be better for the mother to still breastfeed their child, but under specific conditions. So someone living with HIV, we talk about viral load, and we also talk about CD4 count. So viral load is the amount of HIV virus in the blood, or even in the other fluids, like vaginal fluids or semen and things like that. And then CD4 count is your white blood cells. So usually we say someone is undetectable if they have, let's say, 50 copies of the HIV virus, and the CD4 count is, let's say, 1200. So for someone not living with HIV or cancer or any other autoimmune illness, their CD4 count is usually about 1200. So technically, that's someone considered a healthy person. So in that case, if a mother is meeting those conditions in different parts of the world, breastfeeding sometimes is recommended because they don't have any other option. But in Canada, there's free formula available to mothers for up to 2 years, and oftentimes if a mother needs it longer, it's also available to them. So, breastfeeding is beneficial, but in the case for HIV, it's not an indirect cause, it is a direct cause. HIV virus can be found in breast milk, and it can be transmitted to the child that way.
I agree with the exceptional cases used for. I agree with that. But 99.9.
Excuse me if you ask question again.
No, this was not a question. This was a comment. I am done.
Yeah, thank you. So you can.
It is a good comment, and thank you for bringing it up, but as part of my role, I would say, and especially because we are in Canada, mothers living with HIV do not breastfeed your baby because you'll also get in trouble for that if that happens. But then also putting it into context, some communities, some cultures, as a mother, if people see you're not breastfeeding your child, people ask questions. Why are you not breastfeeding your child? Because in my community, you're supposed to. So with HIV, this is where stigma comes in. And some mothers, because they do not want to tell people they're living with HIV, they may make the choice to do that. So we say blood as one way where HIV virus can be found. We say breast milk. What else? There's 5 things. So I have 2 there. So blood and breast milk. And what else?
Intercourse.
Intercourse. So what fluid do we have when intercourse is taking place? Semen. Yeah, semen.
Instrumentation.
Menstruation.
Instrumentation.
What is menstruation?
Those people, they are going to
Also like tattoos maybe?
like
Okay, so through needles,
Yeah.
and that would be transmitted again through blood. So whether it's tattoo or piercings, okay. So what are the fluids? We have blood, semen, and breast milk. I need 2 more. And when we talk about semen, we also talk about pre-cum. Okay? Semen and pre-cum. HIV can be found in both. Is everyone clear? Does everyone know what pre-cum is?
No.
So pre-cum is what comes before semen. So a lot of times when people talk about pre-cum, it's usually, let's say you're having intercourse, and then people worry more about pregnancy usually. So they would say, okay, well, before someone comes, they'll pull out. But the pre-cum that comes before the semen actually has HIV. It contains the virus. Okay? So 2 other fluids.
There's a tears,
Tears don't sweat.
saliva.
Saliva doesn't. Sweat doesn't. Urine? Urine doesn't. So for women, what is it? Discharge or vaginal fluids. HIV can be found there. And then also rectal fluids or anal fluids for both men and women. Okay? So we talked about the transmission, and give me some activities that HIV can be transmitted through. So you mentioned about instruments, so through tattoos, needles, sharing, piercings. What else?
But that is only if the instrument being used are not properly cleaned.
Yes, so if they're not properly cleaned.
Only then.
Yeah. And when we also talk about instruments, the other main thing to remember is about hepatitis C. So I'm not sure if everyone sees on the TV, every once in a while public health will come on TV and say this tattoo parlor has been closed or this tattoo parlor is being investigated, people being asked to go get tested just in case. So hepatitis C is very, very big for tattoo, piercings, and also injection drug use when people share the needles. And hepatitis C lives outside the body for days. Unlike HIV, it can stay in a needle for days, or if it's even on the surface, it can stay for days. Yeah, so hepatitis C is a very big concern.
HIV don't stay for very long.
HIV dies in a matter of minutes, seconds. Very fast. Very, very fast. And with HIV, if let's say blood spilled here and someone's concerned that the blood may have HIV virus, bleach actually cleans it. If you clean with bleach, bleach cleans it. For hepatitis C, I don't think so, but for HIV, bleach can clean. Okay, so you mentioned needles. What else? So breast milk breastfeeding is an activity. What else?
I think that any kind of, all kinds of contact with the patient can cause the transmission of this or any other disease.
No.
Not any time, no. If I shake your hand and I'm HIV positive, you will not get HIV. If I hug you, if I don't know, kiss you, or if I do something, you will not get HIV. So there has to be specific things that happen. Intercourse? But what kind of intercourse?
Without a condom.
Yeah.
Without a condom.
So without a condom, there's a risk of getting HIV.
Yeah.
So can you use 2 condoms while having sex to protect yourself from HIV or any other sexually transmitted diseases? Can you use 2 condoms at the same time? Yes? No?
Yes.
At the same time?
For a woman and for men.
Okay. So no, you cannot. So whenever you use condom, always use 1. Even if it's 1 for the man or 1 for the female, always use 1. Because what happens, the friction, it tears the condom. And then your condom becomes useless at that point. So always only use 1. And then we also have female condoms. I don't have any, but sometimes when we have some, we distribute them, but they're very expensive. But so that's why you said female and male condoms. Okay, so what other activity?
Even in the surgical intervention,
Yeah.
you should have some gloves and protection.
Okay, so another one we talk about that doesn't happen often here, it's very small percentage, is mother-to-child transmission. So when a mother is pregnant and they can transmit HIV virus to their baby. But
Through birth.
Either through birth or even through, again, it goes back to breastfeeding once the baby is born, or even through when the baby is still just in the stomach. So transmission can happen. But it doesn't happen very often here. It's a very, very small percentage. I think it's about 3% it does happen. Because once a mother is on medication, then the doctors know, they monitor them, and when the baby is born, the baby is given medication for a certain amount of time, and then they do follow-up, and a lot of the children born are fine. They don't have HIV. So, that being said, can women have children? When they're HIV positive, women have children.
Yes.
Healthy children.
Healthy children. And nowadays we have many couples who are living with HIV having children. So there is something called sperm washing where the men's sperm can be cleaned and then inserted to the woman, and then pregnancy can happen. So it's expensive and not everyone can access it. So what happens is, for someone on treatment, if both people are on treatment, then you can still safely have children without the worry of HIV transmission. And if you're working with your doctors, then they monitor you and they help you through the process. So that kind of goes through the process of transmission. And the one last thing I'd like to mention about that is there has to be enough amount of the HIV virus for transmission to occur. And that's why I said HIV is also a very difficult virus to transmit. If there's not enough amount of virus, doesn't mean you get HIV right away. Okay, so when you talk about HIV, we talk about no risk, negligible risk, low risk, high risk, and looking at some of the most common ways is through like sexual activity, anal or vaginal sex without condoms, or sharing needles or other equipment to inject drugs, or equipment that's not been sterilized. So doesn't mean that every time, let's say you have sex without a condom, you get HIV. Not necessarily. Again, the conditions have to be perfect, and sometimes people are in monogamous relationships and HIV still happens. Some people have multiple partners, HIV happens or not. So it's really, really different. And that takes me back to HIV stigma that we're talking about. There's very different ways people can get HIV. Some people are born with it. Some people get it through needles. Some people through blood transfusions. In Canada now, that doesn't happen through blood transfusion, but some countries it still happens today. But what's happening now, because of, I believe, the 70s, 80s, when blood was never really being clean, what's happening now is finding a lot of people being tested for hepatitis C now. And for a lot of people who've had it for many years, but the symptoms haven't manifested until now. So there's a generation of people getting more and more tested positive for hepatitis C. And hepatitis C can be treated. The treatment is very difficult and doesn't work for everyone. It works for a certain percentage of people, but there's treatment available. So we've kind of talked about this, about transmission, and one thing to ask, what are some sexually transmitted infections that you could name? So HIV is one, what else? Herpes, gonorrhea, yeah?
Syphilis,
Syphilis,
and
there's chlamydia, and many other sexually transmitted infections. So even when we talk about HIV, the context is specific to HIV, but some of the precautions also apply to other sexually transmitted infections. So when we say use a condom, there's also protecting yourself from other sexually transmitted infections. And when you have one of those infections, it also puts you at a higher risk of HIV because it provides, let's say, a sore or a wound, and then there's a way for the HIV virus to get into the body. So it doesn't mean if you have any of these other STIs you get HIV, but it just increases the risk of HIV transmission. So as I talked about before, when we talk about viral load, it's just the amount of HIV virus in the blood, but it could also be in the either semen or the vaginal fluids or the anal fluids. So the amount varies. So someone who, let's say, maybe got infected and within a few months or even a year may have a high viral load, and then once they're on medication, they get to undetectable, which is basically less than 400 or 50 copies depending on the test used. So that means they're having successful HIV treatments, and the tests that they do, they're unable to detect the virus in the body, which is a good sign because it means the HIV virus in the body is very low. And when someone is also undetectable, they're less likely to transmit HIV to someone else. So right now in Canada, there's a lot of cases going on around HIV criminalization and people being arrested and for having, let's say, sex with someone else and someone found they're HIV positive. So people are being criminalized for it. So the law right now in Canada says if you're HIV positive, you have to have undetectable viral load and you also have to use a condom. But that being said, it's very complicated, and sometimes someone can be in a situation where, yes, you use a condom, but the next day someone said you did not use a condom. So the law is very vague and very complicated. So we recommend and tell people, if you know your status, just do what the law says to protect yourself, so that if someone comes up and says, you did this and you did this, you're not criminally liable. And yeah, so if you look in the news, every once in a while you'll hear different cases that go on. Any, okay, questions again? Okay, HIV prevention. How can we prevent HIV? Give me some examples. Yeah,
Having protective sex.
having protected sex. Yep. What else?
Having the partners tested.
Getting tested, knowing your status. Yep. Can you know someone who has HIV by looking at them?
No.
No. So the only way to know is by getting tested. How else can we prevent HIV?
There are HIV medication which are given, drops which are given to children, I guess. Drops.
I don't know about the drops.
Or the medication.
But the medication, yes. So if the mother was HIV positive,
The
then
basic thing to prevent, educating yourself
yes.
and educating other people.
Yep.
And generally education and things like that, so be aware of it. Awareness really important.
Yes. So yeah, everything that's on the screen right now, you can see it. So prevention, testing, education, being aware, and also this is a quote that someone living with HIV said. So how we were brought up, if you're married, you don't use condoms, you don't practice safe sex. It's your husband or wife. You can't do these things. You know it's my husband, why should I? And like men, they will say, oh, maybe you're sleeping around. Maybe you're doing something you're not supposed to be doing. So this is someone living with HIV, and this is just their experience, and the projector has gone off, but I'm almost done. So basically it's just, like when people get in relationships, sometimes you're not able to use condoms, sometimes you're, married couples and things happen, and it's not always possible to use condoms, but I think the most important thing is to be able to educate yourself, communicate, as partners say, let's go get tested for HIV, let's go out to status, and everyone's own responsibility to protect yourself and to protect your partners as well. And there's different types of HIV testing in Ontario. Does anyone know what types they are, or where you can get tested for HIV? Can you ask your family doctor for an HIV test? Yes, you can. That is what we refer to as the standard testing. So you see your doctor and you say you want to get a test, and they send you to a lab and you get a test done. How else can you get HIV tested?
Private clinics.
Yeah, private clinics. They can draw your blood. So any nurse or doctors or even midwives can get your blood and send it for HIV testing. So have you heard of anonymous testing? Yeah, go ahead.
I heard there is a private testing. There's a machine which somebody can test themselves at home. Is it true?
There is, but in Canada, I don't believe it's been approved. In the States, I believe, I don't know if it's all over the States, but in the States, I believe that happens. In Canada, it has not been approved. So, yeah.
One thing, if there is a provision for that, I don't know, because people every now and then get their blood work. And once a year for the yearly medical checkup, they do the blood work. So if there is a provision to check this thing also, if not asked, if not requested, so that should go through that procedure that the person, that the patient does have or does not have HIV or AIDS.
You can do that. There's a Privatization Act which gives you a protection that without your consent, certain things.
Yes, doctor can ask.
So,
You can ask, but they cannot do it.
No, doctor can ask whether you allow the laboratory practitioner or the doctor that this blood work can be done from your blood.
so what happens if to be informed consent. Technically, if a doctor is gonna do that test, they need to talk to you about what they're doing, why they're doing, and you basically have to give consent. If they do it without your consent, then they can be in trouble for that. They're not supposed to.
Yes, everybody does not know that my consent is necessary or not. In the bank, when you go and open an account, they ask you about your consent
Yeah,
to release your information.
yeah.
And when you are with the doctor can ask you that this is your authority, so can we do this
So
out of that?
So that does happen. The doctor is allowed to ask you that, and that's part of giving the consent. They can't just do it without asking. So one of the things that, depending on the doctor you have, depending on the doctor you see, it's very different experience. So you can go in and they look at you and they say, oh, you don't look like you're at risk for HIV. So they may not even offer you a test. But if, let's say, I went in to see my doctor, they know I use drugs, I inject myself, and I've told them this before, and I go in, they're more likely to tell me, you should get an HIV test, as opposed to someone else who doesn't fit their criteria. But as a patient, you're more than welcome to ask your doctor if you want to get a test done. You don't have to wait for them to ask. Some doctors will do it or offer it during the annual test, but it's not routine testing.
The education is the most important factor to do every good thing and keep away from the bad things.
Yes.
Many people are all over the world, and in Canada might have not know about the many things, the laws, their rights, many other things. So you are here teaching us. So we were unaware all these things, some of the things you are teaching today.
So that's why, again, I agree with you. That's why education is important.
Most important.
And I think with healthcare, accessing healthcare, I think a lot of people don't know that you can ask questions, you can ask for things to be done, you're able to communicate with your doctor. And sometimes it feels that the doctor is the one who has the authority, but at the end of the day, it's your health. So you can ask, and if you have concerns about your health, you should ask. Because it's only you, at the end of the day, who suffers, and not your doctor necessarily. And some doctors are good, some not so good, some are excellent. So you just hope you find the ones who are good. And then, so the other way for testing, I will wrap up and then give room for questions. But the one thing I just want to talk about testing is, in Ontario, even let's say in Mississauga, you can go and get tested for HIV anonymously. So if you go to the public health clinics, you walk in, you say, my name is Jack, even if your name is not Jack, or if you don't want to give a name, you don't have to. You can go in, you get tested, and then you can find out your test without anyone knowing that you even went there for a test. So what we say, if you want to get a HIV test, we recommend to do through the public health clinics, because you can do it anonymously, and also it gives you time to just, kind of have an understanding and talk to them and understand what does this mean. So what happens when the tests are done through the labs, through your family doctors, that information is sent to the public health units, and then someone may give you a call and say, we got information from your doctor, you tested positive for HIV, and they want to find out if anyone else may be at risk, so they may offer to help you to call them, or they want to they're trying to prevent the spread, and that's why they do that. So we always recommend to go to the public health unit. If you're comfortable with your doctors, that's fine as well. And